Hello and welcome. You're watching the Daily Report for Thursday, February 3rd. I'm Min Sun-hee. The sheer speed of Omicron spread has led to daily record highs here in Korea, as is the case elsewhere in quite a number of countries worldwide. I've Kwon So standing by with the global update. So let's begin here on the local front then.
Sunny, we entered the Lunar New Year holidays with concerns that we might exceed 20,000 cases on a daily basis, and that is now the case. This Thursday, we reported over 22,900 infections as of 12 a.m. And apart from 134 cases from abroad, the rest of them are domestic transmissions. And if we go over to our map, we see that all major cities or provinces are now in red, meaning every place is reporting at least triple-digit figures of infections, even on Jeju-do Island as well as Haedong City, and the capital's whole a record high with over 5,000 new cases, and Gyeonggi-do Province way more than 6,000. And if we go over to our graph here, we are seeing that for the second straight day we are in the 20,000s, and another all-time high has been posted on this February 3rd. And compared to last Thursday, it is quite an on-week surge. Now, with that, Korea has a total of over 907,000 COVID-19 infections and more than 6,800 COVID-19 related fatalities, with 25 people having lost their lives in the past day. Now, meanwhile, the number of patients that remain in critical or severe condition, that has been remaining in the 200s for almost the entire week, as you can see here. And vaccinations are also continuing to be under process. However, not that many inoculations happened over the Lunar New Year holidays or the weekend. But if we go over to the number of people that got their third dose or booster shot, that has now surpassed 27.2 million, which is equivalent to 53.1% of the population. Let's now move over to the international figures. There's been a rise by almost 3.3 million new COVID-19 infections around the world, with an addition of more than 13,600 fatalities. And in the past days, or in the past day, there were countries that made new milestones in their COVID-19 figures. We've got Germany and Spain now both having hit the 10 million mark, and also we've got the Netherlands having surpassed Indonesia, and that's showing that still many European countries are dealing with the rampant spread of the Omicron variant. Also, Russia is seeing resurgences, now having hit 12 million as of this Thursday, Korea time. And those are the general updates that I have for now, but I'll see you again in a bit. Sunny?
All right, so thank you for those global tallies. Now we take a closer look at the domestic COVID-19 situation, and for that, our Choi Min-jung is here in the studio. Min-jung, it's great to see you again.
Thank you for having me, Sunny.
Right, then let's begin with the inclusion of medical clinics in treating COVID-19 patients.
Sure. Starting today, people will be able to get diagnosed and treated for COVID-19 at hospitals and clinics in their local communities. Around 700 clinics and local hospitals will be providing these services. They will provide one-stop services, basically meaning that those with symptoms can visit a nearby clinic and get tested for COVID-19. And if they test positive, that clinic will be in charge of prescribing medication and managing their recovery at home. If a person is experiencing a fever or respiratory problems, they can go to a designated local clinic and get tested for COVID-19 using a rapid antigen test. If the person tests positive, they would then have to take a PCR test. And once the person is confirmed with COVID-19, they will receive a prescription and medication and will be monitored by the clinic as they recover at home. It should also be noted that PCR tests will only be carried out for those at high risk, like people aged 60 and over, as well as those who came in close contact with a carrier. Once they test positive and are assigned to be treated at home, they will be monitored by hospitals 24/7. Medical staff will call in to check their conditions twice a day. But on the other hand, those who are at lower risk can get rapid antigen tests as well as PCR tests if needed at local clinics. Their monitoring will be less intense with once-a-day health inspections.
Right. Min-jung, I hear there have also been some discrepancies with regard to test results. Tell us a bit more about that.
Recent data from testing centers showed that not everyone who tested positive for antigen tests gets positive results for PCR tests. Data from 4 regions which carried out the new testing system earlier than the rest of the country showed that only 76% of those with positive results from rapid antigen tests were confirmed with COVID-19 after taking the PCR test. This means nearly 1 in 4 people tested positive for the antigen test but negative for PCR. This is mainly because antigen tests are much speedier but less accurate than PCR tests.
Right, and now despite the added capacity for testing, I understand concerns remain with regard to effective monitoring and treatment of COVID-19 patients.
Right, Sunny, the country has been reporting over 20,000 daily cases for 2 days in a row now, and officials are expecting the daily tally to hit the 100,000 mark in the coming days. And what's worrying is the available capacity for home treatment patients. As of Thursday, 97,000 COVID-19 patients are recovering at home. This is an increase of more than 7,700 from the day before. The government says that the maximum capacity for at-home treatment is currently at 109,000 and nearly 90% is currently in use. By next week, authorities are expecting the number to hit 110,000. And to keep up, officials are looking for ways to expand the number of hospitals that manage home treatment and use patient monitoring resources more efficiently.
Right, I see. Now, with regard to prevention efforts, Minjung, our current guidelines are scheduled to end this coming Sunday, right?
Right, and authorities will be announcing new social distancing measures this Friday. This comes as the current measures, which include limiting social gatherings to 6 people and business hours to 9 p.m., are due to end this Sunday. The next measures will have to consider the current virus situation now that the Omicron variant has become the most dominant strain and daily cases are spiking because of it. But health authorities have said that it is best to tackle the spread of Omicron without imposing new restrictions. This comes as authorities are bracing for a potential 5th wave, with the number of infections expected to surge coming off the long weekend.
Right, and before you go, Minjung, do tell us a bit about the new COVID-19 regulations at cram schools and shopping malls, which are slated to begin next week, I hear.
Right. Starting Monday, new rules are set to be put in place for these venues to minimize the spread of the virus. At places of learning such as cram schools and study cafes, students must sit 1 seat apart from one another. Previously, the limit was set to 1 person per 4 square meters, but it has now been revised to 1 person per 2 square meters. On top of that, authorities have banned promotional events, small concerts, and eating in stores at large shopping malls and supermarkets. Officials have advised movie theaters, concert halls, museums, and art galleries to strengthen antivirus measures as well. The stricter rules come as vaccine pass mandates were lifted at these venues last month.
Right, Minjung, as always, and thank you for that report, and see you on Friday.
Thank you.
Right, on the international front, now neighbouring Japan has been posting record case counts in recent days, and for more on that, you have details, I hear.
Yes, Sunny, I have. So the highly transmissible Omicron variant in Japan has hit the country more earlier than here in Korea. And for the first time, daily cases have surpassed 90,000 on Wednesday local time. Now, that's nearly 10,000 more than its previous record on the 29th last month. 18 prefectures posted all-time highs. The capital, Tokyo, on Wednesday reached more than 20,000 infections for the first time. The hospital bed occupancy rate has risen to above 51%. Now, earlier, 50% was the threshold that would result in a state of emergency, but officials now say the decision will depend on other factors, including the number of severe cases. Considering the characteristics of the Omicron variant, including the apparently shorter incubation period, Japan's health ministry announced on Wednesday to shorten the self-isolation period for family members who live with COVID-19 patients to 7 days from a maximum of 17 days. Japan, meanwhile, also on Wednesday reported the first COVID-19 case among Japanese athletes who are currently in Beijing for the Winter Olympics.
Right, so and speaking about the Winter Olympics over in Beijing, the event is scheduled to start on Friday. What is the latest there?
Well, Sunny, it is the second Olympics that are being held amid the COVID-19 pandemic, and it is expected to be held under the most strict virus prevention measures, with the Olympic torch relay also having been shortened to 3 days. It has kicked off on Wednesday yesterday, and as I said, it's been shortened to minimize the risks of infections. And despite the highest level of precaution under China's zero COVID-19 strategy, which includes a so-called bubble system that requires athletes, officials, staff, and journalists to remain in separate bubbles and allows spectators only on an invitation basis. Organizers, that is, were, however, not able to keep infections at zero. On Wednesday, an Olympic medical panel said that 11 personnel were hospitalized due to COVID since January 23rd, and a total of 232 cases were linked to the Olympics, with 163 of them detected at the airport and 69 within the closed loop or the Olympic bubble. Now, while authorities are putting safety as the top priority, data security has been named as a concern by guests from abroad, as a mandatory app will require them to submit personal information to check their health status on a daily basis.
Right, well, let's keep our fingers crossed for a safe and successful hosting, of course. Meanwhile, so over in the US, I hear Omicron is showing visible signs of a slowdown.
Right, Sunny. So the daily average of cases in the U.S. has dropped to a little over 400,000 now, according to the New York Times. And as of the 1st of February, the daily average in the past 7 days was around 44% lower than 2 weeks ago. Around mid-January, daily cases soared to above 800,000, which appears to be the peak of the Omicron virus for now in the U.S. However, COVID-19 related deaths are up by 39% from 2 weeks ago, with around 2,600 people dying on average a day. Meanwhile, with infections among children also having risen amid the latest wave, the U.S. is considering the approval of vaccinations for kids aged under the age of 5. Pfizer has started to send data this week for an emergency use authorization by the FDA.
Right, and going back to the slowdown over in the U.S. now, regardless of that trend in the U.S. and of course similar trends in the U.K. and South Africa, I understand the global health body is calling for caution against COVID-19, of course.
Right, Sunny. So earlier this week, the WHO made such warning. I just mentioned the death rate. Actually, the number of deaths in the U.S., for instance, is still on the rise despite the overall drop in cases. So what the WHO noted is that since Omicron was first identified 10 weeks ago, almost 90 million cases were confirmed around the world, and that is more than entire 2020. Now, let's take a listen to what the WHO chief had to say in a recent remark.
It's premature for any country either to surrender or to declare victory. This virus is dangerous, and it continues to evolve before our very eyes. We're now starting to see a very worrying increase in deaths in most regions of the world.
Now, regarding the evolving of the virus that the Director General just mentioned, he said the organization is currently tracking 4 sublineages of the Omicron variant, the variant of concern, including the BA.2, which is also dubbed the stealth Omicron variant, and that, according to the organization, has been detected in at least 57 countries.
Right, including South Korea. Let's end with a rather intriguing trial over in the UK in which young participants, I understand, are being offered a dose of COVID-19.
Sunny. So those were 36 healthy and young people aged between 18 and 30. Some reports say 34, but I will refer to the number on the website of the study conductors. Now, they received a low dose of the virus in a trial that was the first of its kind that conducted the infection and recovery from start to finish on humans. So what did the study find? Nearly half of the participants did not test positive. Those who did get infected had mild to moderate symptoms, including sore throats, runny noses, as well as loss of smell and taste. The latter symptom was said to have gone away in most patients within 90 days. Some of those who got infected had no symptoms. The study also found that infection happened on average 2 days after the volunteers were exposed, and that rapid antigen tests were reliable in indicating the virus. The results also said that the virus peaks about 5 days into infection. The study, conducted by Imperial College London, still needs peer review, but it is seen as a great opportunity for further human trials in a safe manner.
Right, I see. All right, then, so thank you very much for the latest, and see you on Friday.
See you tomorrow.
Come Friday this week, the United Nations Security Council will reportedly convene a closed-door consultation on North Korea's latest test launch of a ballistic missile that took place earlier this week. Our Yoon Jung-min reports.
The United Nations Security Council is set to hold a behind-closed-doors meeting on Friday afternoon, New York local time, on North Korea's recent missile test. That's according to Russia's TASS news agency, citing diplomatic sources. This follows North Korea's 7th missile launch in January and the longest-range one in about 4 years, an intermediate-range ballistic missile that has the ability to hit the U.S. territory of Guam. Earlier, the U.S., along with the UK and France, had requested the meeting, reportedly for Thursday. Separately, the UK, France, and Germany on Wednesday strongly condemned the North's missile tests and urged the regime to comply with UN resolutions. In a joint statement, they called a series of missile tests by Pyongyang provocative actions that undermine peace and security and violate multiple Security Council resolutions. They called on North Korea to accept offers of dialogue by the U.S. and take actions toward the complete, verifiable, and irreversible dismantlement of weapons and missile programs. The condemnation was also echoed during a phone conversation between the chief diplomats of the U.S. and Japan on Tuesday. U.S. State Secretary Antony Blinken and Japan's Foreign Affairs Minister Yoshimasa Hayashi reaffirmed their trilateral cooperation with South Korea for the complete denuclearization of the Korean peninsula. Aside from the missile tests, North Korea has recently signaled a possible resumption of nuclear and ICBM tests, further raising tensions. Yoon Jung-min, Arirang News.
In other news, the Biden administration is dispatching more troops to Eastern Europe to bolster NATO forces and to deter a potential Russian attack on Ukraine. Kim Yo-san has more.
The U.S. will be deploying additional troops to Eastern Europe.
As part of this commitment and to be prepared for a range of contingencies, the United States will soon move additional forces to Romania, Poland, and Germany.
The Pentagon announced Wednesday that the new deployments include 2,000 troops to Poland and Germany. In addition, around 1,000 American troops based in Germany will be transferred to Romania. The spokesman stressed the move is aimed at temporarily bolstering the U.S. and its allies' defensive positions.
These are not permanent moves. They are moves designed to respond to the current security environment. Moreover, these forces are not going to fight in Ukraine. They are going to ensure the robust defense of our NATO allies.
The deployments could also signal Biden administration's willingness to take more proactive military moves as Russia's buildup continues, despite ongoing diplomatic efforts to try and resolve the Ukraine crisis. Moscow immediately criticized Washington's announcement, calling the deployments, quote, unfounded and destructive. Unsurprisingly, the head of NATO welcomed the U.S. decision, describing the deployments as, quote, defensive and proportional. Saying the move is a powerful sign of U.S. commitment, he added it sends a clear message that NATO will do whatever is necessary to protect its allies. Kim Yo-san, Arirang News.
On the national front, Korea's 4 main presidential candidates are poised to partake in their first live televised debate at 8 p.m. on this Thursday local time. Now, ahead of this much-anticipated interaction, our Kim Do-yeon tells us a bit about the candidates and their commitments.
The ruling Democratic Party presidential candidate Lee Jae-myung was most recently the governor of South Korea's most populous province of Gyeonggi-do. He began his political career in 2010 as the mayor of Seongnam City, and before that was a lawyer. But Lee worked in factories during his teens and still has an arm injury from that time. He earned his school diplomas through the Korean version of the GED before studying law at college. He's now known for his direct and sometimes fierce way with words.
이번 대선은 과거로 회귀할 것인지 미래로 전진할 것인지가 결정되는 중요한 선거입니다.
Lee won the primaries in the first round, beating the likes of former Prime Minister Lee Na-kyun. Now he faces challenges, such as the recent polls showing the majority want to change the ruling party, the rumors over his involvement in the Daejangdong land development scandal, and his use of abusive language toward his family members. The main opposition People Power Party candidate Yoon Suk-yeol had been a prosecutor all his life, having loyalty to law, not people, as he once said. He was appointed as the prosecutor general for leading the investigations into the corruption scandal that led to former President Park Geun-hye's impeachment. But Yoon decided to resign over the intensifying feud with the current government, triggered by his investigations into former Justice Minister Cho Guk, and later he decided to run for president.
국민 여러분은 저와 우리 당의 정권 교체의 엄중한 사명을 주셨습니다.
Despite lacking political experience, Yoon won the PPP's nomination. Now, the political novice will have to use the debate to show he has the ability to handle state affairs and clear up family scandals. The Justice Party presidential candidate Kim Sang-jung is a 4-time member of South Korea's National Assembly. As a university student in the mid-1980s, she jumped into labor rights movements when South Korea was experiencing a fast economic boom and many blue-collar workers were left without protection. Now a leader for the country's Progressive Party, she is vocal on issues such as LGBTQ rights and protecting the environment.
정의당이 큰 정당이 아니라도 20년간 신념을 지켜온 정당과 사람이 꼭 필요할 때가 있습니다.
On her path this time, she narrowly beat her competitor and the party's former leader Lee Jung-mi. During the last presidential election in 2017, despite earning the most votes by a progressive party in recent times at 6.17%, she came last among the 5 major candidates. The minor opposition People's Party candidate An Chul-soo was a medical doctor and then an IT CEO who made antivirus software. Later, as a professor and mentor, An gained popularity among the younger generations, paving the way for him to enter politics. His first bid was in 2012 as an independent candidate, but he dropped out in the middle to support another candidate. But An says that will not be the same case this time.
저는 대통령 선거에 출마한 이유가 제가 대통령이 되고 정권 교체를 하겠다 그렇게 나온 겁니다.
But unless his ratings go up drastically, observers say the possibility of another alliance between An and Yoon as a single conservative candidate will be a key topic in the coming debates. Kim Do-yeon, Arirang News.
Let's take a look at what's going on in the world now. Israeli Defense Minister Benny Gantz began his visit to Bahrain on Wednesday after missile attacks on the UAE by Yemen's Iran-aligned Houthi movement during a visit by Israel's president on Monday, the third attack in 2 weeks by the Houthis. The visit by Gantz also marks the first time an Israeli defense minister has visited the Gulf nation or that an Israeli military aircraft has even landed there. This was all made possible by the U.S.-brokered Abraham Accords signed by Bahrain, the UAE, and Israel, which was built on common interests and concerns over Iran. However, in disclosing Gantz's official visit, the Israeli defense minister made no mention of the recent Houthi attacks, nor did he give details of the security talks with Bahrain. Over to Peru this time, as the country's president Pedro Castillo on Tuesday swore in new Prime Minister Hector Valer, replacing Mirtha Vasquez, who resigned Monday due to a disagreement with the president. Valer becomes Castillo's third prime minister after just 6 months in office. Valer was elected as a conservative lawmaker in July, before switching sides to a bloc promoting constitutional change earlier this year. The new prime minister has been open about his support for amending the country's market-friendly constitution. This is important as President Castillo said he wanted to redraft the constitution to prioritize public investments in health and education, not to mention higher taxes for multinationals. Castillo also named his finance and energy ministers, although his new cabinet still needs to be confirmed by Congress. According to Brazil's National Space Research Institute, deforestation in the Brazilian Amazon set a new January record, adding to concerns over surging destruction in the world's biggest rainforest. From January 1st to the 21st, nearly 360 square kilometers of forest cover was destroyed, an area more than 6 times the size of Manhattan. By comparison, deforestation in January 2021 accounted for 83 square kilometers, less than a quarter of the latest figure. Environmentalists predict another devastating year for the Brazilian Amazon in 2022, where deforestation has surged since President Jair Bolsonaro took office in 2019. A man seen waving a face mask which he had removed from his face interrupted Pope Francis's general audience at the Vatican on Wednesday, shouting, "This is not the Church of God," before being taken away by police. The Pope heard the shouting, although it's unclear if he understood what the man was saying. After being taken away, the Pope asked those in the audience hall to join him in saying a prayer for the man.
A few minutes ago, we heard a man who was screaming, shouting, who had some kind of problem. I don't know if it is physical, psychological, or spiritual, but he is a brother of ours who has a problem. I would like to end by praying for him, for our brother who is suffering. Poor man, because if he was shouting, it is because he is suffering.
According to witnesses, the man was also heard shouting the word mask and was sitting alone at the back of the audience hall, away from the section where most people were seated. 이승재, Arirang News.
Quite a number of events here in this part of the world made international headlines this week. And for details on them, I have our Kim Sung-yeon here in the studio with me. Sung-yeon, welcome back.
Great to be back, Sunny. So we have more international coverage regarding North Korea this week. And then we have some new developments on a historical dispute between Korea and Japan. We'll also be talking about a new Korean drama series that's all the buzz on Netflix. And lastly, a medals forecast for the Beijing Winter Olympics. So let's dive right in. Major foreign news outlets were all talking about North Korea's latest missile tests, where it tested its longest-range weapon since 2017. North Korea's missile launch from Sunday sparked fears the nuclear-armed state could resume long-range testing, according to Reuters. Analysts were cited as saying that the tests appear to be aimed at securing global acceptance of its weapons programs. The Associated Press wrote that the Kim Jong-un regime seems to be reviving its old playbook in brinkmanship to get concessions from Washington and its neighbors, particularly amid a protracted diplomatic stalemate. Meanwhile, an expert who spoke to NPR said the North will likely carry out more tests if the U.S. imposes fresh sanctions, with other experts even raising the possibility of a nuclear test as well. In the meantime, they noted that the North could temporarily suspend its weapons tests during the Beijing Winter Olympics in consideration of its most important ally, China.
And staying within the region, Sung-yeon, so Seoul and Tokyo are looking ahead to more fierce debate over historical matters, you say?
Yes, Sunny, so it does look like a bilateral historical dispute between the two sides is deepening as the Japanese cabinet on Tuesday decided that it would seek a UNESCO World Heritage List designation for a gold mine on Sado Island, which began operations 4 centuries ago and closed in 1989. Now, so Korea argues that Japan is looking to cover up its history and the facility's use of forced labor from Korea, expressing great regret over the campaign. The Japan Times said the battle over the mine could set the tone for Japan's ties with Korea following Prime Minister Fumio Kishida taking office in October and Korea set to elect a new president in March. The report further mentioned that the Japanese government has said very little about the human rights conditions at the facility where more than 2,000 Koreans worked during the Japanese colonial era from 1910 to 1945. Furthermore, the report says that the issue has been raised at a critical time when the Biden administration needs Seoul and Tokyo's cooperation on North Korea's latest weapons developments. It noted that the Sado mine dispute could cloud future discussions between Korea, the U.S., and Japan when they meet for discussions on Pyongyang's missile tests.
On a light note now, Song-yeon, let's talk about the most recent Korean drama on Netflix.
Yes, Sunny. So this show is called All of Us Are Dead, and it is a classic zombie tale set in and around a Korean secondary school, with the show becoming the #1 hit on Netflix in 46 countries. So Variety emphasized that ever since the Squid Game phenomena, global audiences cannot get enough of not only the typical traditional Korean drama fare, but also its thrillers and reality series. All of Us Are Dead made its debut on Netflix's non-English language TV Top 10 list for the week of January 24th through the 30th, with nearly 125 million hours viewed. The report said this marks the most hours watched in the premiere week for any Korean title since the streamer began releasing its Top 10 data last year. The Guardian was also full of praise in its review of the series, noting that the plot is a nod to the world we currently live in, as we mark the 3rd year of a pandemic that has killed millions and devastated families all over the world.
Right, and also on a bright note, Song-yeon, I understand there have been some favorable forecasts with regard to Korea's medal tally at the upcoming Winter Olympics in Beijing.
Yes, Sunny. So even though Korea actually has said it has a rather modest target this time of winning just 1 or 2 gold medals, it seems that observers from overseas have a much more optimistic view in their medal predictions. So the Associated Press gave its medal predictions for all events, which were released on Tuesday, and it had 4 gold medals and 3 silvers pegged for Korea, including 1 gold by short track speed skater Lee Bin in the women's 1500 meter. The other 3 golds predicted included short track speed skater Hwang Dae-han in the men's 1000 meter, also men's 5000 relay, as well as snowboarder Lee Sang-ho. Now regarding Lee Bin, she was in fact the overall leader in the women's 1500 meter event during this past International Skating Union World Cup season, with 2 gold medals and 1 silver medal across 4 competitions. Now, following her training session on Wednesday and being told of AP's forecast, Yi said she was flattered, and despite feeling some pressure, she said she would embrace those expectations and use it as a confidence boost.
Right, and our best wishes, of course. All right, Song-yeon, thank you for that coverage.
Thanks for having me.
Starting on this Thursday, Korea's COVID-19 strategy takes on a number of changes to better address the challenges brought on by Omicron. For more on the domestic situation, I have Professor Kim Moon-gyu from Yonsei University. Welcome back, Professor Kim.
Good afternoon.
I also have Professor Lee Yoon-sang, also from Yonsei University. It's good to see you again, Professor Lee.
Thank you for having me today.
Right, Professor Kim, let's start off this session with your assessment, perhaps, of Korea's current COVID-19 situation.
I think Korea is going to follow the pattern of other countries with minor differences. Actually, the slope of the graph is very steep in USA or UK or Germany, Denmark, Israel, whatever. But I'm expecting the slope might be a little bit less steep in Korea, but there's a high possibility that the graph might be wider and maybe prolonged or broader, I would like to say, if we have stricter quarantine measures compared to other countries. That will give temporary relief in most of the hospitals, and that the doctors deal with those many patients. About 1 month after the Omicron peak, the confirmed death rises in UK and United States and Australia. So is it going to be the same pattern in Korea? I don't know yet, but I would say that one stitch in time saves 9. So we have to be prepared for adults and also for children getting sick.
Right, of course. And talking about patterns, Professor, authorities claim the daily tally may hit 120,000 towards the end of this month. Do you share this outlook?
Yes, especially with the traditional Lunar New Year holidays, where many of the people have been traveling to their hometown, and there must have been increased level of the social gathering. So I think at this moment it is quite inevitable to see some of the rise, especially with this Omicron variant becoming dominant variant, which as the Omicron variant is more transmissible. So with these situations, it is quite inevitable to see the rise of the cases. And in this case, the government will be slowly shifting its approach to less stricter social quarantine measures and focus more on the high-risk cases. With this situation, in all, with this situation, we will inevitably see rise of the COVID-19 cases for the time being.
Right, and against that backdrop, Professor Kim, the so-called stealth Omicron has been detected here in the country. We spoke about this last month, of course, and according to the Global Health Body, it's been detected in 57 countries. What more can you tell us about the traits of this particular sub-variant of COVID-19, of Omicron, of course, and how does it look to affect Korea's latest wave, Professor Kim?
Omicron is an umbrella term for several closely related lineage of SARS-CoV-2 coronavirus, and the most common one is BA.1, and now more countries in Asia and Europe, there are increasing cases of BA.2, which is also known as stealth Omicron. If we look at the Delta variant, there are more than 200 subvariants, and for Omicron now we have about 3 or 4. BA.1, 2, 3, and further. So if we compare the two BA.1 and 2, I mean, there are 20 mutations apart. They are different. And it was first reported in the Philippines last year in November, followed by Denmark and India. And it's actually spreading more fast than BA.1. And the report from Denmark and UK says that it's more transmissible compared to the BA.1. And the severity is almost same as the BA.1. So that means this stealth Omicron is not causing that severe cases, luckily. But there's no sufficient data until now. So we have to wait and see, but no cause for alarm at this stage.
Right. Professor, starting on this Thursday, rapid antigen tests will be offered to most of the general public here. Now, in light of this reality, what do you propose to perhaps compensate for the relatively lower accuracy of these tests compared to PCR tests?
So with this rapid antigen testing kit, if you are tested positive, it will not mean if you are confirmed for COVID-19 infection, but we will go through the additional PCR testing for final confirmations. But I think what is concerned is for those people who are false negative, because we are seeing that about 35 to 40% of the false negative cases happening in many of the testing kits. So in this case, even though you are negative in the rapid antigen testing test. Still, if you still have any kind of symptom, maybe it might be necessary not to rely wholly on the rapid testing kits, but maybe the testing may need to be repeated, or it might be important to consult with the doctors to make sure that if you need confirmation PCR testing.
Right, so you need to be cautious even after the rapid antigen tests.
Sure.
Professor Kim, what are some points to keep in mind when using these rapid antigen tests at home?
Well, if I tell you the basics, you have to do the nasal swab enough and mix with the test tube thoroughly, and you put drop by drop to the test device, and you wait for 15 to 30 minutes to find the result. There's a control line. It should be present every time you do the test, whether positive or negative. If that line doesn't show up, that means you need a new device and repeat that test again. So there's one line with the letter C, which means control, should be positive all the time. And there's another line, T line, we would say that if it's positive, that means you got COVID-19. But as Professor Lee mentioned, the negative result does not guarantee you are free of COVID-19. So if you are exposed, if you have symptoms, if you are high risk, or one of your family member is high risk, you might have to repeat those tests the next day. And if you have a positive result at home, and if you did not conform with PCR test or at the private clinic, there's no official reports about your results. So you have to remember, if it's positive, you need a confirmation from the clinic or a hospital, whatever.
Right, I see. Professor, some are calling for preemptive government action, that is, to address a potential widespread shortage of these rapid antigen test kits. Do you believe such action is necessary?
Well, I think with the rapid antigen testing kit, I think the problem is not the problem of productions, but the problem of distributions. So unlike the mask shortage situations in the early and mid-2000s, and the mask is actually very essential components of your protection measures. So, but right now, this rapid antigen testing kit is somewhat more of the complementary measure for RT-PCR testing. So, in this situation, I think the issue is the problem of distributions because of the rapid increase in the demand. So, and at this moment, the government had been working with the producers to come up with additional 9.6 million kits in the local pharmacy, and also 6.8 million kits in the testing and screening facility as well. So I think unlike the mask shortage situation of 2020, I think eventually I think the distribution problem will be subsided. So maybe we don't need the drastic measure to come up with the testing kit supply measure.
Right, and keeping in mind what Professor Ie just said, Professor Kim, what are your thoughts on better addressing the potential distribution problem with the rapid antigen test kits then?
Well, basically I agree with Professor Lee, but I would like to mention about the flexibility we should have. I mean, if you can do the PCR test, you don't have to go through that rapid antigen test, especially for elderly with underlying conditions. And well, I don't know how it's going to roll out, but if we have enough capability to do the PCR test, I think that will be a priority. If it's not, then you do the antigen test first and then confirm by other methods like a PCR.
Right. Professor, also on this Thursday, healthcare clinics located within neighborhoods will be sharing the medical burden of treating COVID-19 patients. What are some precautions to keep in mind in light of this reality?
So with the imminent increase of the COVID-19 cases, it is quite unavoidable to have the help from the local clinic to participate in the COVID-19 case management, especially for the less severe patients. So that's what the governments are doing. But some of the concerning aspect is that in the local, small local clinic, the movement, the entrance gateway and the movement route of the movement path of the patients, COVID-19 patient cannot be separated from the regular patients. So that is one of the concerns. So, but as we are expecting about 1,000 local clinic and small hospital participating in the COVID-19 response for treatment of the COVID-19 patients. So I think what might be necessary is at least for COVID-19 sampling and testing, screening, testing process, maybe the area, it will be great if the area can be separated or enclosed, because the suspected COVID-19 case patients will be taking off their mask. But also, if you are thinking you are having any kind of COVID-19 symptoms and you are visiting a local clinic, it will be best for everybody for you to make sure to keep the mask on. And it will be important for everyone else who are visiting those clinics as well.
Right. Professor Kim, as my colleague Min Jung mentioned earlier, currently we have 97,000 COVID-19 patients being treated at home. How can we ensure proper care and monitoring of these patients?
I would like to tell you a short case, what I experienced, to share that how difficult it is. There was a patient with abdominal pain. He visited the emergency department. And we got a suspicion of intussusception, which is a obstruction of intestinal bowel. And we need to do some kind of ultrasound, and we have to go on with reduction to ease that problem, to solve that problem. So when we do that kind of procedure, we do the COVID-19 test and confirm he is negative. So he was negative. We did the procedure, and it was successful. The patient had to admit to hospital because sometimes it recurs. So he was in the general ward because he was negative for COVID-19. But about 3 days after, he started to have fever. So we repeated that COVID-19, and he was positive. So we checked all the medical personnel who contacted this patient, and one of the radiology residents turned to be positive because of him. So we are dealing with very difficult cases. So whenever you stay home, I mean, you have to be vigilant from the beginning to the end. And now we have medication, Paxlovid. I would like that our government secure more of these medications and ease some indications to use these medications. So it will ease this high rocket rising Omicron outbreak. And if I can mention more about pediatric cases, it's really rising exponentially. As I was on duty during this Lunar New Year's holidays. But current healthcare system is more like an adult-oriented structure. So let's say for children, the simple blood test, IV line maintenance is difficult. It's only possible for experienced nurses and doctors. And as the medical charge is very unrealistic for this case, we have only few facilities remaining this whole capability to deal with this COVID-19 patients. Clinics and hospitals are facing very difficult time already to maintain these trained nurses and doctors. So I think government has to change strategy and put more focus on children. And for emergency room, we are constantly running out of beds to care for children. So we need a special measure to face this Omicron outbreak in a very urgent time, short period of time.
Right, and within this time, of course, Professor Lee, also this month, Novavax's COVID-19 vaccines produced locally by SK Bioscience will be rolled out. What can you tell us about their efficacy and their potential impact on the relatively small portion of unvaccinated adults that we have here in the country?
I think there has been quite a duration of the clinical testing on Novavax. So as for its efficacy, I think we do not have to have much concern about it. And I think with this Novavax vaccines, it is locally produced, and also it is kind of a type of a very traditional type of vaccine. So for some of the cases, maybe it can be quite reliant options as a vaccines. So I think starting from coming month, I think we will have this vaccine available to be rolled out. But as for people or teenagers or school-age children under 18 years old, there has not been clinical testing yet. And it is still undergoing clinical testing in the US. So for any of those students in the age between 12 to 17 years old, we have to see yet if we can roll this out in Korea.
Right, and staying with vaccinations, Professor Kim, authorities here have pledged to draw out a vaccination plan for children aged 5 to 11 this month. What are your thoughts, very briefly speaking, on the necessity of this plan?
Always we have to think about the benefit and harm, and it should be balanced. The purpose of vaccination program for children is to protect children or to protect adults or to prevent severe cases coming out from children age group. I would like to mention one thing about our situation, that one of the high risk factor is the obesity, and the situation is different from country to country. We have a report from UK that compared the obesity among OECD countries, and that the high obesity country is Chile, Greece, and USA, and the low obesity country is Japan, Korea, and Slovak. So if it's that the case, I think Korea has less risk for children if we get COVID-19. So the benefit-harm balance is going to be different from the United States. I'm a pro-vaccination doctor, but my opinion is we have to give priority to the basic vaccinations which children should have, like MMR or DPT or whatever. And I think there should be no more class suspensions. And if the vaccine is to protect adults, I think that should be unnecessary for children.
I see.
And as Professor Lee mentioned, I'm waiting for Novavax trial for children.
Right.
Yeah.
All right, Professor Kim, as always, thank you very much for your insights. Professor Lee, thank you for being here today.
Thank you very much.
Right, Korea's daily tally is expected to maintain its upward trend this month, so do seek to abide by prevention guidelines to keep potential repercussions to a minimum. Thank you for watching. See you on Friday.